everyone. Welcome to Bringing Virtual Care Home. My name's Tina Null. I'm the Chief Clinical Officer at Anelto and your host. My guest today is Ian Koons, who is the co-founder and CEO of Karoo Health. And today we're going to be talking about cardiovascular care in a more digital world. So, welcome, Ian. Can you share with our audience a little bit about your background and what got you to where you are today?
Thanks, Tina. Thanks for having me. So, background really within kind of the healthcare vertical started about 10 plus years ago. I had started a healthcare staffing consulting firm. And that's really kind of where I cut my teeth within healthcare. So, we would staff nurses, PAs, NPs in a variety of settings. And then from there, was recruited to really run growth at M&A for two leading women's healthcare organizations. And that kind of fast forward to today in terms of why Karoo, why now, and kind of our story. And so it started about a year and a half ago. I was talking to a good friend of ours, Chad Moore. Chad founded Karoo Health Research. That was a really successful company. And, we were talking just like I was talking to you about what's going on in healthcare and the changes. And he really explained to me that he wanted to do something within cardiovascular care, really stemming kind of from the disjointed, unsupported experience that his dad had with cardiovascular disease. And it just so happened that my best friend had a heart attack and passed away at 29. And so, kind of the light bulb went off. And I always wanted to do something in cardiovascular care, whether it was a technology and or a care delivery model that would have saved the people that I love and care about. And so light bulb went off, and we ended up doing a kind of a deep dive on the current state of cardiovascular care. And through that, we got connected to Mark McClellan, the old CMS administrator. And he was commissioned by the American Heart Association, basically say, why are outcomes getting worse, not better, when nephrology, oncology, all the other disease states have made notable advances in outcomes? And unsurprisingly, the results were misaligned incentives with physicians, and there's no value-based care. And so we spent, the last 6 months of that year really going to cardiologists all over the country. And we would ask them one simple question, which was, if you had unlimited time and resources, how would you build, a care delivery model that actually put patients first, drove those outcomes and changes, and made the overall system more efficient and effective for the people that needed the most? And so they all said it had to be this hybrid delivery model. And so what does that mean? It means having the existing cardiology practices when needed, having this wraparound services, the nutrition, the RPM, to make sure in a coordinated effort that patient is front and center, at 24/7. And so that's kind of what we've built today, and hopefully, we'll continue to build something meaningful in the future.
Wow, that's wonderful to hear. I mean, as a several decade nurse who worked primarily in health systems, it's not lost on me that some of the most, and I'm going to use air quotes, frequent flyers into the emergency department were congestive heart failure patients. And when you think about the fact that they're trying so hard not to be a burden to anyone while they're trying to deal with a complex condition with lots of different symptoms, the fact that the fact that traditional care is delivered in a physician's office once every 6 months or so leaves a huge gap for them to fall through on a daily basis. So can you tell us a little bit more about the hybrid model and how that prevents those gaps in care?
Yeah, so we partner directly with existing cardiology practices, kind of to enable that wraparound services, the technology within a value-based care contracting. And so what does that mean is that these frequent flyers, Tina, that you had alluded to, the complex, we run, kind of the data analytics on the front end to identify who those people are. And so instead of 6 weeks for an appointment, we're solving for access with our partner cardiologist. And then from there, instead of a 3-minute visit, they're getting a 30-minute comprehensive to go through where they are on their disease stage. Typically we see more on the later stage, you called it out, kind of CHF patients, the frequent flyers. And from there, after going it through medication management, we've embedded within a hybrid model our what we call coaches, our Karoo coaches. And there's a physical handoff, right, that eliminates that gap in care. And at that point, our Karoo coach will walk through their medication management, their nutrition, and really how to use the technology. We've made it just completely SMS based because what we've found and realized through years of failure is that people don't like apps. They don't like complex technologies. It has to be simple and user friendly. And so through just the text messages that ties into the EMRs, we've built that. And then based upon where they are on their disease state, we've set up a cadence with their nutritionist and their health coach to ensure that it's the right cadence to make sure that when they need the care, that they don't necessarily need to go to the hospital, that we're there monitoring, in a 24/7 way to solve that access and really put the mind at ease of that particular patient.
Yeah. So your solution does not include virtual video visits?
No, it does.
It
So
does.
what'll happen? So the standard interventions is through text messages, but then through the RPM and through some of the connected devices that we do have, if someone calls out, I have tightness in my chest. There's those triggers. That's escalated to the EMR and to our kind of staff that then directs that virtual so that we can see in real time video through those RPM what the state of our patient is at any given time. But we believe in terms of that initial communication that SMS is sufficient and easy to use. But then when applicable, which is a key component, is that video to really put the eyes on the patient.
Yeah, agreed. And so your patients are set up to transmit biometrics to your monitoring team on a daily basis. Is that correct?
Yeah, so we have connected devices on, as you are a clinician, you know that there's triggers specifically for cardiovascular, whether it's 5 pounds in 5 days or salt sodium intake goes over a certain threshold, and so we're monitoring to that, and if that threshold is exceeded, that triggers us to be proactive from a video as well to reach out to the patient to make sure that they're not progressing in that disease state.
Yeah. And so what credentials do your monitoring team hold? Are they nurses? Are they, um,
It's a varying, so mostly nurses from the Karoo coaches. There is the LCSWs because, as you know, a lot
mhm.
of this is there's the psychology behind making incremental changes to the benefit of the patient, and so that's why we think kind of the nursing background, the LCSW, is so important to the overall success and connectivity of the solution we're ultimately building.
And what is your patient compliance like in transmitting daily?
So we're actually launching with that 165,000 patients go live in April is when we're launching with this particular solution.
Okay. And do you guys intend to use any internal devices or only peripheral devices?
No, so there's internal. We're the way our approach is. There's lots of great, Tina. I think your company does as well. There's a lot of great off the shelf technologies that exist, right? And I think within the healthcare we have a skewed preference that it has to be built from scratch so we control it. And we don't necessarily think that's the right approach. We think that there's great partners and vendors that we can partner with that puts patients first, saves really money and for the patient and the payer itself. And so then we'll build proprietary technology on top of that.
Yeah. So you might have felt like you've already answered this, but I'm going to ask again for the audience sake. What would you say the biggest challenges are for cardiovascular providers and patients in the current traditional healthcare models?
Yeah, no, absolutely. It's access, right? You often have that patient that just a general patient, whether they have a cardiovascular issue or an appointment, takes 6 weeks to see the average patient. And so imagine what somebody who's further along in that disease state goes through that has systolic, diastolic, congestive heart failure, AFib, where the default is the ED, where if they call, what is everybody's going to say, if this is emergency, go to your nearest ER. And the way that we think about it is by enhancing the experience and solving for access, and really completely flipping the script on the way that patients in typical cardiovascular fashion interact. That's the way really what we're solving for, that they feel supported and they feel that they have Karoo and their cardiologist backing them through their current disease state.
And so, can you talk a little bit about what the role of the coach is that becomes a part of the care team?
Yeah, I mean the coach is really in the name, coach. They're an advocate. They're a friend. They're someone that can make sure that that person is incrementally making those steps and changes, to be adherent, to live their best selves essentially, and given their clinical expertise, they can identify if said patient is going down the wrong path.
Okay, so they are in essence an educator of the patient to learn about their condition so that they can modify lifestyle in a way that mitigates symptoms.
Exactly, and it's both in person, so they know that person is there, and then in a virtual setting as well, right? So I think I had alluded to that the Karoo coach is embedded within our partner cardiology clinics, but then we go one step further, and they have the remote virtual check-ins as a key component of the hybrid delivery model that we really think is the future.
Oh, that is wonderful. So, do you have any like a centralized monitoring team, or are all of the monitoring clinicians kind of a satellite in the practices that
They're typically satellites right now. That may evolve and change over time, but typically it's that way.
Okay, great. Well, so what is next for Karoo Health?
So exciting news for us. It's been a long journey. So we're launching with 165,000 patients, over 100 providers, 75 cardiologists in Arizona, as well as in New Mexico. And that goes April, hopefully April 1st is launching there. And then we recently have a verbal agreement from one of the largest health systems in the U.S. And, to kind of partner with their existing cardiology network to bring this type of model of wraparound services, virtual care, to the greater network of that health system.
Wow. Okay, so you say April is the big date. Is that correct?
That is the big date.
Yeah, yeah. Well, listen, I wish you and your company a lot of luck. I don't know if you've considered incorporating health surveys as a daily interaction on the part of the patient, but our company does that. And to be able to collect qualitative data about symptoms and well-being along with the quantitative data, the biometrics, really paints a comprehensive picture that if someone's watching that daily gives you a great opportunity to catch these patients before they so-called fall.
Yeah, I would love to learn more. I mean, the reality is if there's any solutions that are going to make the lives of the patient, the provider, the payers better, then we want to partner with those type of organizations.
Yeah. Well, I hope we stay connected, Ian. Thank you for being my guest. And thank you all for joining Bringing Virtual Care Home. I hope you'll tune in for our next episode. Have a great day.